Hey everybody, Dr. Geada here from Lancaster, South Carolina. What we're here to talk about today is chronic illness and a functional medicine approach towards that. Before we get into chronic illness, we need to understand the difference between acute problems and chronic problems. An acute problem is something you just did. You broke a bone, you sprained an ankle, you have a high fever, and traditional medicine does a wonderful job with that. But what we need to understand though is in chronic illnesses, these are problems that just don't go away overnight. They've been lingering around and they're just not getting better. Sometimes you get better, sometimes you get worse. So the functional medicine approach towards that is looking at your body's metabolism, trying to understand what's going on from a physiological point of view, from digestion to blood sugar to hormonal. There's lots of systems in our bodies that need to be working the right way in order for our body to be healthy. To understand the metabolic issues that can be going on with these chronic problems is we have to understand metabolism. What metabolism is, simply put, is your body breaks down food and uses it as energy. There's lots of steps that have to go right in order for that to happen. Things such as food intolerances or sensitivities or allergies, chronic bacterial viral infections, the pH of your body needs to be appropriate. There's lots of steps. You need the right type of vitamins. Your body needs to process the foods the right way. All of these steps have to go in line to get to that end point of energy. 30% of that energy, when your body breaks down food, actually goes to your brain. And when that's deficient, then we start to develop functional neurological issues. And these aren't things that show up necessarily on an MRI or a CT scan. These are problems that are associated with things like sensory problems, movement problems, and cognitive problems. By sensory, we're talking about things like pain. Your body should be able to sense different things. A lot of patients will come in, they'll have numbness, tingling, they can't feel their feet. They have chronic pain issues. And a lot of these patients are classified as fibromyalgia. So if you don't have the right energy going to your neurological tissues, then that could create chronic sensory problems. Another is movement. By movement, it could be tremors. A lot of patients will come in and they'll have weakness in legs and arms. Those muscle spasms, vertigo, balance disorders. These are all functional neurological issues. You need the right energy, you need the right supply to the neurological tissue for that to work the right way. The other is cognitive problems. We see a lot of patients that they're classified, or they have what we call brain fog. They're not as sharp as they used to be. They don't remember things as well as they used to, and that can create lots of issues in your life. So the functional medicine approach towards this is to look at these underlying systems, look and figure out what's going on with somebody's metabolism in order for their body to process foods the right way, to balance blood sugar the right way, to hopefully handle hormonal issues the right way. That process allows our body to create that energy, the powerhouse of our body. And when that can occur, then neurologically a lot of these things get better. So this is a lot of the work that we try to do here and try to educate patients on. If you want more information on this, just please call the office. It's 803-283-8442, and we'll get you some more information. Thank you.